Hi there, I'm Dr. Lynn Seibert. I'd like to take a few minutes to discuss how we assess whether or not your pet's behavior problem might benefit from medication. I am a licensed veterinarian with specialty board certification in veterinary behavioral medicine. I also have master's and PhD degrees in psychology with a focus on neuroscience, and I operate a practice in Lawrenceville, Georgia, dedicated exclusively to the treatment of animal behavior problems. Undesirable behaviors that may be of concern to you can arise from normal behaviors, poor management choices, training failures, health problems, or an actual behavioral abnormality or pathology. So the first step is to see your veterinarian. Whenever you have a behavioral concern with your pet, it's important to evaluate your pet for any health or physical problems. Any behavior change could be caused by a health issue. Only licensed veterinarians can legally diagnose mental and physical illness and prescribe medication. Do not take medication advice from non-veterinarians. Only your veterinarian can determine which medications will be safe and appropriate for your pet. What if your veterinarian does not have a lot of experience with behavior medicine? If your pet's behavior problems are beyond the expertise of your regular veterinarian, you can visit the website for the American College of Veterinary Behaviorists. There you'll find a directory of licensed veterinarians who have completed advanced training in behavior medicine. Board certification with the ACVB requires a minimum of 4 years of additional training after obtaining a veterinary medical degree, as well as examination. There may also be an individual in your area who is working to complete credentials with the American College of Veterinary Behaviorists. These veterinarians are referred to as residents. Another resource is the American Veterinary Society of Animal Behavior. On their website, you will find a directory that includes veterinarians in general practice who have an interest in treating behavior problems, as well as individuals who have advanced graduate degrees in animal behavior. So to drug or not to drug, that's the question we want to answer today or discuss today. These are the questions I ask myself when I'm making decisions about a patient's medication options. The first question is, can your pet make progress or make adequate progress with a behavior modification plan without the benefit of medicine? If your pet is too agitated, too reactive, too aroused to learn, then your pet may need some medication. The next question is, do the potential benefits of medication outweigh the potential risks? Any medication can have side effects. In fact, all medications have potential side effects, and this is a question that you can discuss with your veterinarian. Another important aspect is quality of life. So if your pet's quality of life or your family's quality of life is significantly impacted by the behavior problem, then it may be time to discuss medication treatment. Another question for you is, have you discussed the limitations of medications, and do you have realistic expectations about what can be accomplished with behavior drugs? Drugs don't provide a cure, and it's important that you understand what to expect. And the last question that I ask is, have you considered rehoming your pet? And this is significant because my primary focus and my main goal in practice is to keep your pet in your home, reduce anxiety, improve quality of life, and keep you all living peacefully together. Medicine is not a cure. If all you do is give a pill, you will likely be disappointed in the outcome. Medications help reduce anxiety, reactivity, and impulsiveness so that your pet can learn better coping skills. If your pet is overly anxious or excited, your training plan will be less effective. So the purpose of medicine is to help facilitate learning and training. Medication also will not prevent a bite. So giving a behavior drug is not a substitute for enacting appropriate safety measures and management. General obedience or group training classes or board and train programs may not be the answer for your pet. Pets with significant behavior problems often need a specific behavior modification plan that uses positive reinforcement to teach them to relax in stressful situations. This is not about obedience. This is about helping your pet relax and learn better coping skills. Do not use aversive physical corrections or products that cause discomfort, such as shock, prong, or choke collars. These are inappropriate and may backfire and make problems worse. Work with trainers and consultants who use only positive reinforcement and who participate in continuing education programs. If you need some tips on selecting a good trainer, you can visit the AVSAB website and look at their position statement. Chronic anxiety and stress and emotional suffering can have a significant negative impact on quality of life. So if there are medications that could lessen your pet's emotional distress, then that is certainly something that we need to consider. So ask yourself, how stressed is my pet? How often is my pet stressed? What percentage of the day? And can I avoid any of the stressors or triggers? If your pet is constantly bombarded by situations that cause reactivity and anxiety, then medication may significantly improve quality of life. So let's look very briefly at some of the indicators of stress in dogs. Excessive panting when your dog is not overheated or thirsty can be a sign of stress, in addition to yawning or lip licking. Holding the ears persistently back or down, avoidance of contact or hiding, and shaking or trembling can also be signs of distress. In addition, dogs that salivate excessively, engage in destruction of property, or pace excessively may also be under stress. And aggression is also a sign of anxiety in dogs. One of the most common reasons for aggression in dogs is fear. So could your pet benefit from behavior medication? First, you understand the limitations of medication and what will be involved in an effective treatment program besides medication. Is your dog frequently anxious or unable to settle based on some of the signs we discussed in the previous 2 slides? Is your dog unable to make progress with behavior modification training due to anxiety or reactivity? If you answered yes to any of those questions, it might be a good idea to speak to your veterinarian about some drug therapy. Thank you for listening. If you need more information about our services, feel free to visit our website, gavetbehavior.com.